Hello, I'm Mary Slavin. I'm co-leader of LEARN's Didactic Core, and I'm pleased to introduce today's presentation in our series, Using Rehabilitation Systems Research, Health Systems Research to Revolutionize Rehabilitation Care. So I'd like to note some accessibility options. We do have closed captioning enabled, and you can see there are two options. You can either select Show Captions if it's visible, or if it's not visible, you can select More to access the closed caption feature, and then select Captions. You can then choose your preferred language. And as I said, this is part of a series, and we have some new events that have been archived, and you can view these presentations using the link that's provided in the chat. And today's Grand Rounds presentation follows a webinar presented by Kristen Rosengren, Strategic Communication Strategies for Research Impact. And again, that is also available in our archive presentations. And with that, I'm pleased to introduce our speaker today, Dr. Pimjai Sudsawad, the Associate Director in the Office of Research Sciences at the National Institute on Disability Independent Living and Rehabilitation Research, or commonly known as NIDILRR, the Administration for Community Living, ACL. Dr. Sudsawad is a subject matter expert in knowledge translation at NIDILRR and has developed, refined, and managed NIDILRR's knowledge translation program over the last 15 years. This is just a brief demonstration of the agenda. As you can see, we're going to have Dr. Sudsawad's presentation, followed by a live Q&A. So we ask you to post your questions using the Q&A feature of Zoom, and we'll address them once the talk concludes. And then after the presentation, we're going to post an evaluation link so that you can provide some feedback for us. And then finally, we'll wrap up our time together by sharing some upcoming Learn events, funding opportunities, and also a brief survey. In between, we're also going to conduct a poll, and that poll is going to give us some information about the level of interest and expertise in the audience. So I'm now going to introduce Dr. Sudsawad to present knowledge translation, the what, the why, and the how. Welcome, Dr. Sudsawad.
Thank you for the introduction, Mary, and good afternoon, everyone. My name is Pimjai Sudsawad, and I am the Associate Director of Research at the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDILRR for short. NIDILRR is a center within the Administration for Community Living, which is an agency under the umbrella of the Department of Health and Human Services. I am delighted to have an opportunity to talk to you about knowledge translation today, as this is a topic that near and dear to me. And also at NIDILRR, we believe that knowledge translation is an integral part of our processes, and that would help us in our endeavor to achieve our mission. Before I begin the conversation today, I just want to mention that at NIDILRR, we do not have any specific model or framework that we follow strictly in our approach. We are using a combination of thoughts from many exemplary frameworks that are currently available to us, and that would fit within the context of our operation as a funding agency, and certainly a combination of those approaches that we think will help us to achieve our mission, which is the bottom line of why we are interested and we are implementing the knowledge translation principles. That said, our approach and thinking is based upon previous excellent work of many scholars in the knowledge translation field, as well as other related fields such as knowledge transfer, knowledge utilization, knowledge mobilization, diffusion of innovation, implementation science, along with many others such as social validity, ecological validity, clinical significance, and others. So let's move next to talking about NIDILRR mission. So NIDILRR mission is to generate new knowledge and to promote its effective use to improve the abilities of individuals with disabilities to perform activities of their choice in the community. and also to expand society's capacity to provide full opportunities and accommodation for its citizens with disability. As you can see in this mission, promoting the use of knowledge is an integral part of our mission and goes hand in hand with generating the knowledge itself. It is implicit in our mission that promoting the use of knowledge to make sure that it gets used by relevant user communities is crucial for the desired outcomes to occur. So let's move to talk about what we sponsor as a funding agency. As a federal funding agency, we sponsor 3 areas of activities or 3 buckets, including research and development, capacity building, and knowledge translation. In research and development activities, we sponsor research and development projects in all stages, using a variety of research methods as appropriate to the stages that were proposed. Particularly, we are interested in funding projects that would eventually lead to the development, testing, and implementation or use of interventions, as well as engineering products, development and testing, and technology transfer. With the overarching aim of improving long-term outcomes and community living of people with disabilities. We mainly fund applied research under the social model of disability, which is a holistic model that understands disability as a function of individual and environmental level factors. For capacity building, we provide funding for the training of new and early career investigators in conducting disability research and development. And last but not least, we also fund activities related to knowledge translation in order to achieve our part of our mission, which is to promote the use of findings and products resulted from the NIDILRR-funded research and development by relevant user communities based on the type of findings and products of which we are promoting their use. So we probably should then get back to, okay, what does NIDA think knowledge translation is? We think of knowledge translation as the multi-dimensional active process of ensuring that new knowledge and products gained through the course of research and development ultimately improve the lives of people with disabilities and further their participation in society. As you can see from the definition, this is very specific to our context, and we believe that having the specific vision is essential to be successful so that there is a specific goal that we would like to achieve with the knowledge translation framework that we are implementing. Additionally, we believe, and certainly in agreement with many scholars and knowledge translation, that KT is built upon and sustained by ongoing interactions, partnerships, and collaborations among various parties with vested interests, including researchers, people with disabilities, practitioners, policymakers, and others in the production and use of such knowledge and products. Certainly, the parties of vested interest are determined by the research and development area itself. If you are doing research in one area, the parties will look different from those in a different area. For instance, if you do research related to rehabilitation intervention, the parties may include therapists and other clinicians, people with disabilities, their family members, the payers of the services, hospital administrators, and policymakers, among others, depending on your specific intervention. However, if you do research related to intervention to facilitate community participation of people with disabilities, the relevant parties may include, again, of course, people with disabilities and their family members, this time could be community providers as opposed to clinician. Could involve local and state policymakers, architects, builders, and again, many others, depending on what type of community participation intervention you are developing and testing. Both NIDIL and its grantees use KT principles and practices to promote effective use of NIDIL-funded knowledge in products. So what are the KT principles then? First of all, we believe that KT is not an event, but a process with many different components. KT encompasses all steps between the creation of new knowledge and its application to yield beneficial outcomes for society. And all of those components must be taken into consideration in order to achieve optimal outcomes or impact as a result of the use or implementation of such knowledge. Continue with our KT principles. As we mentioned previously and emphasize here again, that KT is underpinned by effective exchanges between researchers who create new knowledge and relevant parties of vested interests in the creation and use of such knowledge. In order for the knowledge to be used effectively to achieve the desirable outcomes, there needs to be a philosophical change of how research is viewed, as well as practical changes to implement the alternate way of thinking in all of the components within the KT process. Therefore, if we want the optimal outcome, that we would want to use a systematic approach and implement the KT way of thinking and practices into all components rather than using a piecemeal approach, meaning that thinking about and implementing KT strategies on some components while neglecting others. So the next question is the why, right? Why are we doing KT? So let's talk about why knowledge translation is important for at least from our perspective as a funding agency. We certainly believe that using knowledge translation framework will help to increase both the relevance and applicability of knowledge produced with NIDIL funding. And as a result, that would help to increase the likelihood that the knowledge can and will be used in real-life settings. That would in turn will increase public benefits and enable optimal return on research and development investment using public funds. What are some of the knowledge translation characteristics in a nutshell, given what we talked about so far in the principles? So certainly knowledge translation is interactive and dynamic because you need to connect with many people and many parties who have vested interest in the topic that you are studying. Certainly, during those interactive and dynamic processes, you would need to have multi-directional communication. The communication would not just flow from researchers to the parties with vested interest, but also it would flow back and also around and to different people talking together to find out what might be the best way to approach this topic. It also involves, of course, extensive partnership and collaboration. It would be involving multiple activities because, as we talked about before, that we want to implement the thinking, the KT way and the KT thinking into all components of the process. So it will be multiple activities that needs to be done in order to achieve that desirable process. It is a nonlinear process. You may need to go back and forth and, going around. And once you receive output, input, and feedback, you may need to go back to the drawing board. You may need to adapt your intervention. You may need to modify it, and you may need to retest it. So it is not a linear process in terms of implementing the knowledge translation into your research process. Knowledge translation, the characteristic that is particularly important is it is user and context specific. So anything that is working with one user group and a context may not work readily within another context. And that's part of the reason why at NIDILRR we also aim to create a knowledge base in knowledge translation that is most applicable to disability-related fields. Because as we know that knowledge translation concept originated from the field of healthcare for the most part, but because our research sphere actually involved more than just healthcare, but rather also involved community living, employment, and other aspects. So that is something to be kept in mind when you use applied knowledge translation in your research process, that it has to be user and context specific. And last but not least, knowledge translation aimed at creating desirable outcomes, and also it is impact oriented. We want to see some changes, positive changes as a result of the use of such knowledge. So overall, with all that's being said, what is our vision in terms of knowledge translation? So our vision for ourselves is that NIDILRR will produce high quality and highly usable knowledge and products that are used by people with disability, practitioners, policymakers, and other relevant parties. This use will improve decision-making, conduct, practice, policy, and system capacity that would lead to improving the lives of persons with disabilities and increase their full participation in society. So the next question is the how. What do we do to support knowledge translation, both for ourselves and for our grantees? So the first strategy is that we fund several KT centers that perform various functions related to KT. This is in order to make sure that there are sufficient capacity and expertise to help NIDILRR grantees move along the KT path in their projects. We fund several knowledge translation centers who each serves as a hub in their assigned areas. This is so the grantees could receive consultation, training, technical assistance, and other KT-related services from the KT experts who also understand the users and context within that specific area. As we mentioned before, KT is user and context specific, so it is logical that the KT experts in that particular area would not only be someone who knows a lot about KT, but also has the necessary background in that particular area to put any perspectives that they may have in applicable context. Some examples of the activities by the KT centers include conducting research activities to further understand factors influencing the KT process in disability and rehabilitation. They also provide support for research synthesis in areas where there is sufficient body of knowledge and of high value to knowledge user. They also contribute to the development of standards and infrastructure of KT in disability, independent living, and rehabilitation. They also produce lay language text-based and multimedia products and also promote their use to improve the lives of people with disabilities. And last but not least, they also promote KT capacity building by providing resources, tools, training, and technical assistance to NIDILRR grantees. For the next strategy that we have in our pocket is that in the notice of funding opportunity, we include standardized requirements for the applicants to integrate input from people with disabilities, as well as other relevant parties who may have vested interest in that particular topic in designing and implementing all project activities. In grant competition, we include evaluation factors that reflect the components of knowledge translation as part of the review criteria. And we also encourage and facilitate internal networking of NIDILRR grantees on KT. Could be, networking among themselves, so then they have a chance to share their KT experience and expertise, and also questions, challenges, and also facilitate networking between different groups of NIDILRR grantees to their respective knowledge translation centers. Furthermore, in our reporting requirement, we ask our grantees to report actually their engagement with people with disabilities and other parties who may have vested interest in the research topics and findings, and they need to explain in their performance report how did they go about and do that, and did they run into any challenges, what are lessons learned, anything that they would like to share about that. We also have a module in our annual performance report for the grantees to be able to report the use and adoption of their NIDILRR-funded knowledge and products. We also have a requirement for the technology grantees who develop engineering products or assistive technology to report on their technology transfer plan and how did they go about and achieve that, and where they are in the process. This is to bring the thinking into the forefront of all grantees related to knowledge translation. In addition, we always communicate consistent message from NIDILRR of that we are committed to knowledge translation, and grantees hear that all the time, whether from me, from the project officers, or from the directors, and among others. Additional strategies would be also, as a funding agency, we also want to increase public awareness of NIDILRR-funded work and maintain connection with the disability community and other parties with vested interest in disability, independent living, and rehabilitation research. We take any opportunity we can get, as a funding agency, to promote our grantees' work directly by as simple as mentioning our research projects or our grantees' findings and products to other federal agencies who could use that product to shape their thinking in certain policy or activities. We also fund the National Rehabilitation Information Center, or NARIC for short, to produce several knowledge translation products, and essentially also communication to us, to the community, including, for example, a weekly electronic newsletter, which call News and Notes from the NIDILRR Community and Beyond. And this weekly electronic newsletter would actually highlight NIDILRR grantees' work, either the findings, the products that they develop that community can use readily, lay language resources. We also highlight accomplishment of our grantees related to the work that they do in their research, among others. So this is something that anybody could sign up. And if you're interested, I would encourage you to go to the National Rehabilitation Information Center website, and you can just Google, it should come up, and you can sign up for this. And this is the newsletters feature the resources that people can use. So it's not academic oriented, but rather community and lay language oriented. We also have NIDILRR announcement listserv. If NIDILRR want to make specific announcements to the community, we can use this listserv, as well as alerting people of our funding opportunities. We have a product called Research in Focus, where we work to transform peer review articles that is published to be lay language summary. So then the community could consume the same information in the right format for them. So they would not have to, try to decipher the research articles, which sometimes can be challenging. So we would like them to be able to receive the same information at a relatively same time. And that's why this project is created. The NARIC also is responsible to conduct social media dissemination and activities, and they also use these channels to further help promote the work of NIDILRR grantees. So let's start to get into a little more practical approach as to what are then the strategies then that can be used to integrate the knowledge translation principles and characteristic into the work in research and development. And these are just broad examples, and I will follow up by very specific examples that our grantees actually have done. So you can see how does it look like when the strategies are being implemented in real life projects, so to speak. So example of how a project can implement their KT strategies, soliciting input from people with disabilities and other relevant parties with vested interest to determine the importance and relevance of research topics, questions, or hypotheses. Another way to do it is to incorporate input of the people, including people with disabilities and other parties, in designing the study's methods, such as recruitment methods, intervention, and even measurement of outcomes. You can conduct research in a context that best resembles real-life context, where the knowledge will be applied. So you know that the knowledge that being created has ecological validity that can likely be able to be applied in real-life settings down the road. Another example of KT strategy is to derive dissemination strategies based on the needs of specific user groups. As we mentioned, each user and context is unique, and the dissemination strategy should be derived based upon the need of that particular user group, the communication channel that would reach that particular user group, which the channel could be actually different. The preferred communication channel could be different among different user groups, and also the format of the materials that you would disseminate to a particular user group all need to be considered for the dissemination to be successful. It can also be that you would derive appropriate strategies to facilitate knowledge implementation in real-life settings, such as gain understanding on barriers and facilitators in the implementation context, and then identify appropriate strategy to support such implementation. So right now, we're going to go to illustrations in terms of incorporation of knowledge translation principles, strategies, characteristics in actual NIDILRR-funded projects. The first one that I want to mention, and this is a comprehensive illustration of how NIDILRR grantee exemplary cases in integrating knowledge translation into their work. So the Center on Knowledge Translation for Disability and Rehabilitation Research, or KTDRR, is one of the many KT centers that we fund. They have developed the Knowledge Translation Casebook to highlight NIDILRR grantees' activities in knowledge translation. Right now, the KT Casebook is in its 11th edition, so they've been doing this for a long time, and showcases the exemplary integration of KT principles into NIDILRR-funded projects. And the purpose of developing these casebook is to promote NIDILRR grantees' KT capacity building through learning from each other's experience and sharing new ideas. Let's go to the first specific example, which is the cultural and linguistic adaptation of the Aspen intervention program in low-resource communities. In this illustration, the project engaged parents and other community members in an iterative knowledge translation process to identify and test adaptations to make the intervention relevant and accessible to families with low resources. And this is a project that, as part of the grant to the University of Texas at Austin. So what knowledge translation strategies that they use? First of all, I just want to mention the background a little bit, that this project develops and evaluates a culturally and linguistically informed intervention that is tailored for racially and ethnically diverse families of children with autism in low-resource households. Inclusive interventions that can effectively serve diverse populations require cultural and linguistic adaptations. So the project seeks to develop, deliver, and evaluate the autism spectrum disorder screening and parent engagement, which ASPEN for short. And this intervention program is designed to serve families from diverse racial and ethnic backgrounds in low-resource households. So they first establishing needs through meeting with parent support groups. These connections with parent support groups provided firsthand insight into the barriers to program participation for families with low resources. They also employ a strategy that they were testing and piloting the intervention with families to test an early version of the intervention, and then use the feedback they received to inform program improvements and linguistic and cultural adaptation. These pilot studies illuminated how different ways of organizing the sessions could make it easier for families to understand the material. They also use the strategy of convening a community advisory board of parents and other community members to guide the development of the Aspen intervention program, recruitment approaches for families participating in research, and also other key aspects of the project's work. The advisory board meets quarterly to provide feedback on project activities and help the research team navigate the challenges. The board has 5 members, 3 parents of children with autism, including one parent who is both a self-advocate and a professional who works with children with autism. It also includes a speech pathologist and the president of a community organization for families of children with disabilities. So the board members, as you can see, contribute both professional and also lived experience to the project. They have been particularly influential in helping the project develop outreach strategies to recruit diverse families from low-resource households to participate in the evaluation. So building these community relationships is critical to ensuring that the project serves a broad and diverse population, because a family with low resources tend to have less access to healthcare. Recruiting evaluation participants exclusively from healthcare settings, although could be convenient, would miss many eligible families in need of services. So to reach a more representative population of families that could benefit from the intervention, the Aspen Project's lead researchers regularly attend community meetings and events to discuss the project in both English and Spanish with organizational leaders, family advocates, and other community members. So that is the first example that I would like to highlight. So go on to the second example, which is improving accessible technology for people who have hearing loss or are deaf through an industry consumer alliance. So this project facilitated a shift in the role of technology and addressed the accessibility and usability of technology for consumers who are deaf or hard of hearing, their families and their friends. And this is a project through a grant through to the Gallaudet University. So what are the strategies that they use? So moving on to the strategies, they established the Industry Consumer Alliance for Accessible Technology, or called ICAT for short. It is an online community that provides an easy, structured way for industry and consumers to connect, work together, and inspire better technology for people who have hearing loss or are deaf. The ICAT also help build relationships between technology developers and consumers who have hearing loss or are deaf to promote user-centered design and development. So through ICAT, industry representatives can enlist consumers in product research and testing and talk directly with them to learn more about their accessibility needs. Consumers can also engage in discussion groups and share user experiences. The goal is to make consumer products more accessible for people who have hearing loss or are deaf by putting them at the center of the design and development of those products. So, okay, what else that's being done? So the project used a community of practice model to connect industry with consumers and promote the co-design of accessible technologies for people who are deaf or have hearing loss. The co-designing allows consumers to participate directly in the design process, from identifying challenges in need of technology solutions to serving as a product tester and reviewer. So through the landscape analysis conducted during the first year of the grant, the project partners found that consumers with hearing loss had no place to share their experiences, provide input, or collaborate with technology developers. That's how ICAT seeks to change this by providing a systematic, structure, and sustainable approach to industry consumer partnerships. So going further into the strategies that they are using, certainly you can see that it is, again, the theme is mutual benefit. The partnerships benefit industry by helping developers reach a growing consumer market and benefit the consumers by promoting more usable and accessible technology. The project team used participatory research approaches to involve consumers and industry partners in the development of ICAT 4 components. So even the way that they structure ICAT also is based on the input that they receive from both consumers and industry partners. And just to elaborate a little bit further, ICAT features 4 main components. They have a tech forum, which is a virtual community of practice for consumers and technology developers. This tech forum facilitates discussion between and among consumers and developers and encourages the sharing of experiences, knowledge, and ideas concerning technology topics, and curates relevant resources and event listing related to this area. They also have a feature of user stories that are short personal accounts in which consumers with hearing loss and deaf can discuss their experiences with communication access and technology. They also have a feature called Co-Design Connect, which provides a place where the industry partner can recruit for market research and product testing, and as well as the last component, which is Co-Design Essentials, that provide practical resources for consumers and industry partners participating in the co-design activity. So another the other additional strategy is that the project chose to collaborate with national consumer organization that has long-standing in representing consumer with hearing loss for more than 40 years. And the reason they are doing that is that they now can disseminate ICAT to a wider audience through their partner, as well as planning for sustainability after the grant period ends. So the last example is engaging a diverse group of stakeholders to produce meaningful products. And this project leverages the expertise and experience of consumers and professionals so that products developed from the research are more likely to be responsive to the intended audience's need for information. And this is a project through the grant to American Institutes for Research. How do they do it as far as strategies? They establish a 12-member advisory panel to provide input throughout the project, comprised of members from a broad range of backgrounds, including people with disabilities, primary care physicians, addiction medicine specialists, rehabilitation specialists, disability researcher, and disability advocates. And this project is about opioid use. So that's why you see those parties with vested interest include as such. And this advisory panel provides input on all phases of the project. And the advisory panel has been engaged in all kinds of activities, starting from development research questions for the systematic reviews, creation of the interview guide, recruitment of participants, provider interviews, identification of the screening tool, and also the development of dissemination products. And they use a variety of techniques to engage the advisory panel member, ranging from semi-annual advisory panel meetings to go over different activities, discussing complex topics, provide input, hearing progress about the projects, among others. They also have one-on-one meetings with their advisory board members. In the interval between the full advisory panel, they solicit input also from some individual members who have the expertise on the area that they are seeking advice on. They also have periodic email communication, and administer some surveys if there's a need to do so to get particular input on a specific area. So that's the last example that I want to highlight, and I really highly encourage you to go check out the Knowledge Transition Casebook so that you can read more into the details that these projects have implemented the KT principles in their project. I personally thought, it was a very interesting read. So we would like to encourage you to go explore those. And we also mentioned here the long-range plan that we have, and that may help you understand further of how we look at KT within NIDILRR context. There are a couple monographs here that provide you an overview of the idea of the concept in general and, related to implementation science. And I also provide different resources for free KT training and tools. All of the KT centers produce free resources that, while aiming at increasing NIDILRR grantees' capacity, we also aim to build the research capacity, the research community at large capacity in knowledge translation. So it's designed for anybody to be able to access this resource and learn from it as well. So, and I think that would conclude my presentation. And here is my contact information. Thank you for your attention, and I